Today, and even after we have a vaccine, CDC encourages all Americans to embrace the powerful tools that we have right now, to wear a mask, particularly when they're in public, maintain social distancing, routine vigilant hand washing, be smart about crowds, and stay home when you're sick. And as we move into the fall, we're adding one of the most significant scientific contributions to medicine to our evidence-based mitigation strategies, flu vaccination. Flu vaccine is safe, and CDC encourages Americans to embrace flu vaccine with confidence for themselves, their families, and their communities. These simple actions combined could help this nation avert a very difficult fall, lessening the burden on our healthcare system and saving lives.
Dr. Redfield, your comment?
I'm not going to comment directly about the President, but I am going to comment as the CDC director that face masks, these face masks are the most important, powerful public health tool we have. And I will continue to appeal for all Americans, all individuals in our country, to embrace these face coverings. I've said it, if we did it for 6, 8, 10, 12 weeks, we'd bring this pandemic under control. These actually, we have clear scientific evidence, they work, and they are our best defense. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will. So I do want to keep asking the American public to take the responsibility, particularly the 18 to 25-year-olds, where we're seeing the outbreak in America continue to go like this, because we haven't got the acceptance, the personal responsibility that we need for all Americans to embrace this face mask.
Once again, I think you've refuted the President more eloquently than I've heard.
Tell me when you think we'll have a vaccine, as best you can, ready to administer to the public, Dr. Redfield.
Well, I think as Dr. Cadillac said, I think there will be vaccine that initially be available sometime between November and December, but very limited supply and will have to be prioritized. If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
And so you think by the late second and third quarter, we will have started to vaccinate people?
I think the vaccination will begin in November, December, and then we'll pick up, and it'll be in a prioritized way, those first responders and those at greatest risk for death. And then eventually that will expand. There's about, it's hard to believe, but there's about 80 million people in our country that have significant comorbidities that put themselves at risk. So
right.
They have to get vaccinated.
And
then the general public.
But I'm about to run out of time. And what do you call this effort, this worldwide effort led by the United States of America to develop a vaccine? What is the term for it?
Operation Warp Speed, sir.
Have you ever seen anything like Operation Warp Speed?
It's unprecedented.